Hey, I'm Dr. Dooley Paula. It's nice
Hi.
meeting you.
Nice to meet you.
What brings you in here today?
I have been experiencing a lot of pain through my left wrist there.
Okay. How long has it been going on for?
I'd say like a good 10 days to a couple of weeks, maybe.
Gotcha. Any trauma or injury that you can think of or new activities that you've been doing?
Yeah, probably not like a specific injury as such, other than just having recently commenced a more like intense yoga, and I've been pushing myself more and probably been doing it more frequently.
Gotcha. But you've been doing yoga for a while now, just
Mm-hmm.
been doing it more often.
Mm-hmm.
Any other activities, things that you've noticed when the wrist bothers you throughout the day?
Oh, well, yeah. I mean, just in recent times, just like walking the dog. If I
Mm-hmm.
have to, for whatever reason, walk him with my left hand, that's obviously not helping.
Gotcha. Have you tried anything for it? Any medications?
Just Advil.
Okay.
Just, yeah,
And does that seem to help?
not really.
All right, I'm going to push on a few places. You let me know if any of this hurts.
Mhm. Yeah, just all through that
Okay.
area.
Does this hurt when I do this?
Yes.
Gotcha. Well, I took a look at your x-rays that you had today. Doesn't look like there's anything broken on there or injured. You don't really have any arthritis on there either, which is a good sign. You seems like based off your exam here, you have something that we call Dequer veins. It's a very common thing that we see. Basically, what it is all your fingers and your wrist have tendons on the back here that help you straighten out your fingers and your wrist. And there's a ligament that sits here right on the back of that wrist there. And what can happen is the tendons, as they're running underneath the ligament, can rub up against it and get irritated
Yeah.
over time.
Okay.
And so it causes it to be inflamed, and then you'll get more pain when we kind of pull your
For sure.
finger in that side because it tends to stretch that tendon over the bone. So typically, what we do is just four things for it. One of which is give you a cortisone injection right here, and that's something that we can do today for your Dequer veins.
Okay.
Second thing is I'm going to get you what we call a thumb spica brace. It's a brace that will also immobilize your thumb and your wrist. I want you to wear it as often as you can. The more often you can wear it, the more rest that you're going to give that tendon and help settle down the inflammation. And then the two other things is just I want you to ice it every night for just 5 minutes. And I'm going to call in the prescription for a medication called meloxicam. It's just a strong anti-inflammatory medication.
Okay.
That's how people take it for about 1 week straight, and then just as you need to after that. So maybe right before yoga, and that'll help as well.
All right.
And then I'll see you back in 6 weeks and see how you're doing. Okay?
Okay. And I avoid yoga for now.
Yeah, I would hold back on it if you can. All right.
Right. Okay.
At least until this heals up.
All right. Thank you so much.
All right. I'll be right back with that injection. Okay?
Okay. Thank you.
Thanks. Insert normal right upper extremity exam. Add positive Finkelstein's test. Insert normal right wrist x-ray.